Hello and welcome. This is a COVID-19 and pregnancy Q&A presented to you by the Health and Wellness Clinic for Women based in Pretoria, South Africa. Can a newborn catch COVID-19 at birth? Yes. They can be infected either by contact with their COVID-19 positive mother at birth, or they may get infected in the nursery if they are placed close to another infected newborn baby. However, a mother who had the disease and recovered or in the process of recovery is likely to have transmitted viral particles to the fetus who would be born with immunity to the virus and thus may not be infected even if in the close vicinity of infected people. Infants born to mothers with known COVID-19 at the time of delivery should be considered infants with suspected COVID-19. As such, infants with suspected COVID-19 should be isolated from other healthy infants and cared for as persons under investigation. Physical contact between a mother and a newborn is critical, and separating them at birth may have long-term consequences. Both the CDC and RCOG advise that this be done on a case-by-case basis. The general rule is that the baby should be protected from infection from the mother, and thus, if physical contact is to happen, the baby needs to be shielded. Can a pregnant mother get flu vaccine? Yes, they can, and they should so they avoid getting the ordinary flu during this time of the pandemic. What if you are a frontline worker and you are pregnant? Practice the universal rules for basic hygiene. Make sure you have PPE at all times. Wash hands or sanitize in between each client. If you are wearing surgical gloves, either you use a new pair for each client or sanitize the gloves in between your clients. Do not be complacent. Keep your mask on and do not touch the front of the mask at any time. What evidence is there to date on the risks to pregnancy? So far, the virus has not been found in breast milk, cord blood, or amniotic fluid. But there has been IgM antibodies against COVID-19 found in the babies born from COVID-19 positive mothers. This means that there is vertical transmission from mother to baby. At present, there is one published case of a woman with severe COVID-19 who was admitted to hospital at 34 weeks gestation and gave birth to a stillborn baby by C-section and was admitted to the intensive care unit with multiple organ dysfunction and acute respiratory distress syndrome requiring ICU ventilation. There is also an increased risk of preterm birth or deliveries being indicated for maternal medical reasons after 28 weeks gestation to allow for optimum treatment of the mother. It has long been known that whilst pregnant, women are not necessarily more susceptible to viral illness. Changes in the immune system in pregnancy can be associated with more severe symptoms, and this will be the same for COVID-19. Most women will experience only mild or moderate cold flu-like symptoms. Cough, fever, and shortness of breath are other relevant symptoms. More severe symptoms such as pneumonia and marked hypoxia could occur in pregnant women, so should be identified and treated promptly. There are significant increases in critical illness in later pregnancy compared with early pregnancy. Advice for all pregnant women. Antenatal and postnatal care are essential care, and we encourage women to attend while observing all basic rules of hygiene and social distancing measures. Smoking is associated with worse outcomes for COVID-19. We advise women to quit smoking cigarette. Practice strict social distancing and, when needed, self-isolation, especially those who are 28 weeks and above. This pandemic will inevitably result in an increased amount of anxiety in the general population, and this is likely to be even more so for pregnant women, as it represents an additional period of uncertainty. Specifically, these anxieties are likely to revolve around the following: COVID-19 itself, The impact of social isolation resulting in reduced support from wider family and friends. The potential of reduced household finances. Is there a special diet pregnant women can follow? The diet that is advised to all pregnant women regardless of COVID-19 status is that of a balanced diet. Avoid uncooked foods like sushi, medium rare steaks, raw eggs, etc. Prepare your own green salad, making sure you wash all the ingredients with iced water. Take supplements as prescribed by your healthcare provider, midwife, GP, or specialist. How do pregnant women protect themselves? Pregnant women can protect themselves by following universal precautions and general hygiene principles, which are social distancing, washing or sanitizing hands regularly, avoiding touching your face with unwashed hands, and self-isolating.